Hello, my name is Hannah Moore, and I am a nurse practitioner student at Auburn University. Today we are going to do a complete head-to-toe physical assessment. This is Haley. Hey Haley, how are you today?
Hey, I'm good.
So whenever Haley walked into my office, her gait was steady. She appears to be in good spirits. She appears healthy. She is in no signs of distress. Can you tell me your full name?
Haley Sumner,
And when's your birthday?
November 13th, 1992.
And can you tell me where you are right now?
In the hospital,
And who is our president?
Donald Trump.
Perfect. So Haley is completely alert and oriented to person, place, time, and situation. Her speech is coherent and her speech is clear. Her skin color, she appears pink, no flushing. She is tall and fit, healthy appearing. She is non-obese. Sexual development, she is a young adult female with no obvious signs of abnormal development. Her posture is upright. She slouches slightly. Her dress is appropriate. She is well groomed, and there are no obvious odors. Her vital signs were in normal limit. She is 5'9", 125 pounds. Haley, are you in pain today?
No.
Okay, denies pain. So next we move on to the skin and the nails. I will be assessing her skin throughout this physical, but there's no rashes, no lesions or bruises. Her skin is warm and dry. Her nails, there is no clubbing, no cyanosis. Her cap refill is less than 3 seconds, and there is no skin tinting. So then we will move on to her head. Her hair is thick and coarse. There's no obvious signs of lice, no thinning, and it is evenly distributed. And then on her scalp, there's no lesions, no flakes, and no lumps. And then her skull is normocephalic. There's no depressions, and it appears to be symmetrical. So then we will move on to the face. First, I will test cranial nerve 7. Haley, can you smile for me? Frown, puff out your cheeks, raise your eyebrows, close your eyes, try not to open them. Perfect. So cranial nerve 7 is intact. Then we will test cranial nerve 5. Clench your jaw for me. Perfect. So that is intact as well. Then I will palpate her frontal and her maxillary sinuses. Haley, does that hurt?
No.
Then I will transilluminate the sinuses. And no abnormalities are noted there as well. Then I will assess the temporomandibular joint. Haley, can you open your mouth for me? All right, close. Did that hurt?
No.
Perfect. So there's no tenderness of the TMJ, there's no redness, and there's no swelling. And then I will assess the lymph nodes. There are 8 that we will be assessing: the preauricle, the postauricle, occipital, tonsillar, submandibular, submental, clavicular chain, and then the supraclavicular, cervical chain, sorry. Then we'll move on to the eyes. There are no drooping of the eyelids. The sclera is white and intact. The cornea is intact, and then there is no redness or swelling noted. And then I will palpate the lacrimal gland. Does that hurt? No tenderness and no draining. And then I would have her do cranial nerve 2, which would be visual acuity. And we tested it, and it was 20/20 bilaterally. And then for the confrontation test, I need you to come stand over here for me. All right, and cover your eye. Perfect. And I want you to tell me when you can see my finger.
Yeah.
Okay.
Yeah. Yeah.
Perfect. So I would do this on both sides, but for purposes of the video, we will just do one. All fields are intact and there's no deficits. Then I will do the anatomy of her eye with the ophthalmoscope. So I will test for the lens and the retina. There are no opacities. And then I will test the optic disc and the retinal background, as well as the macula and the fovea centralis. There we go. Perfect. So the lens and the retina, there's no opacities. Optic disc is round. It's yellow, orange in color, and it's defined. The retinal background, there is no hemorrhaging. The macula and the fovea centralis appears normal. Then I will test cranial nerve 3, 4, and 6. So for points of gaze, I want you to look straight ahead. All right, now look at my finger. Now follow it. Perfect. So all fields are intact. There's no nystagmus. There's no lid lag, and there's no and there is conjugate movement for the pupil response. Look straight ahead for me. So Haley's pupils are equal round. They're reactive to light. They're about 3 millimeters. So look at there, that side. Now look at this finger. And they are also accommodating. So for the corneal light reflex, I will shine a light. Perfect. And it reflects nasal to pupil. All right. And then for the cover, uncover test, I want you to cover one eye. Now uncover. Perfect. And there's no lateral movement of the covered eye. Now we will move on to the ears. First, I will inspect and I will palpate the external ear. Is that correct? Okay, perfect. So there's no deformities, no lesions, no pain. Once again, for the purpose of this video, I will just do one side, but for a real physical assessment, I would be doing both. So now I'm going to do the whisper test. I want you to repeat after me. DC32. Perfect. So she responds appropriately. And then I will inspect the inner ear. Perfect. So there are no foreign bodies, no redness, no swelling. The tympanic membrane is pearly gray. It's shiny, and then the colon of light is at 5 o'clock. Then I will test cranial nerve 8 with my tuning fork. So what I want you to do, I'm going to put this on the top of your head, and I want you to tell me if you hear it equally on both sides or more on one side compared to the other, okay? Equal. Perfect. Now what I'm going to do is I'm going to put it behind your ear, and I want you to tell me when you stop hearing the sound, okay? This is the rain test.
No.
Do you still hear it? Perfect. And that's for cranial nerve 8. And then the air conduction is longer than the bone conduction. Then we will move on to the nose. First, I will look at the external surfaces. It appears to be symmetrical. There's no deformities or lesions noted. So then I will palpate. Any tenderness? Perfect. Okay, it's soft, non-tender. All right, close one side and sniff. Now other side. Perfect, so there's no occlusions. Then I will inspect the internal surfaces. The septum appears to be midline. And the mucosa is red with clear drainage. Turbinates, there's no polyps and there's no swelling. All right, Haley, I need you to close your eyes for me. All right, and I'm going to hold something under your nose. I want you to tell me what you smell, okay? All right. Alcohol smell? Perfect, so that tests for cranial nerve 1. Now we will move on to the throat. First, I will assess her lips. There is no cracking. There's no edema, and they're moist. Can you open your eye or your mouth for me? Perfect. So her mucosa is pink, moist, no ulcers noted. Show me your teeth. Open. All right. Say ah. Perfect. So she has no missing teeth or dental caries. There's no gingival swelling. Her palate is intact. There's no cleft, and it rises on ah. Her tongue is pink. It's moist, and there's no lesions. And then open your mouth again. Pull your tongue back. Awesome. And then her stensons and sublingual ducts are visualized. All right, Haley, can you stick your tongue out for me again? Move it side to side, up and down. Perfect. So that checks for cranial nerve 12. There's no deviation. She's able to move it to the right and to the left. And we checked her uvula earlier. It did rise on ah. That also tests for cranial nerve 9. Okay, Haley, can you swallow for me? Perfect. So that is cranial nerve 10, which is her gag reflex. For the purpose of this video, we will not stimulate the gag reflex, but she is able to swallow. For the pharynx, open your mouth for me and say ah. Perfect. So there's no exudate, there's no redness, and there's no swelling. Her tonsils are present. They're not swelling as well. No abscesses are noted. Then we will move on to the neck. First, we will inspect, and we will palpate. There's no scars, lesions. It's symmetrical. And then I'll also palpate for the carotid pulse. One side at a time. They are equal, strong, and present. Haley, can you move your your neck side to side, chin to chest, and back? So she has full range of motion in all directions. Are you able to shrug your shoulders for me? Perfect. And that tests cranial nerve 12. So for her thyroid, cranial nerve 11, I'm sorry. So for the thyroid, I will stand behind Haley and feel her neck. Swallow. Perfect. So her thyroid rises when swallowed. There's no border. Her trachea is midline. No deviation. And does it hurt?
No.
It's not tender. Okay. Now we will move on to the thorax and the respiratory system. First, I'm going to inspect, and you can say just like that. So I'm inspecting the rate and the rise of her respirations. No signs of distress. Equal rate. There's no use of accessory muscles. There's no supraclavicular retractions. For the assessment, I will assess posterior first. So first I will inspect. There's no deformities. Everything appears to be symmetric. All right, can you take a deep breath? All right, lung expansion is symmetric bilaterally as well. Now I will palpate posterior chest. Anything hurt? So it's non-tender. I didn't feel any crepitus, and there was no abnormalities noted. Now I'll assess the thoracic spine. Any pain, tenderness? All right, and there also appears to be no malalignment. And then the ribs. Anything hurt? No abnormalities there. Then I will test for CVA tenderness. Any pain? Perfect. So non-tender CVA. And then fremitus, what I want you to do is say 99 each time I move my hands, okay? Go ahead.
99, 99, 99.
Perfect. So there was no decreased fremitus. So now I will percuss, and I will start on the right side and move in a ladder pattern down your back. Perfect. So there was resonance throughout. And now I will also take in the same pattern. All right, deep breath. Perfect. So there were equal vesicular sounds in all fields with no adventitious resonance. So then I will inspect her chest anteriorly. So I will check to see if there is any asymmetry. Take a deep breath. There appears to be not. And then I will check this. Great. And then her coastal angle is 90 degrees. So then I will palpate and then percuss. Okay, and I will palpate before I percuss. Any tenderness? No. Awesome. So there are, it's non-tender, no crepitus, no abnormalities noted, and there is resonance throughout, and then I will also take. All right, so there are no adventitious breath sounds, and they are equal in all fields. So now we will also inspect the breast. So if you will turn back for me. For the purposes of this video, we will not have Haley remove her shirt. But first, we would have you with your arms raised, breast appear symmetrical, and then we would be completely flat for this exam. And then you would take one arm, raise it behind your head like this, and this is also how you can do a breast exam at home. You would start at the talus fence, feel the lymph nodes in the axillary as well, and then come down and palpate the breast in a circular motion until you get to the nipple. So there's symmetrical, no dimpling, everything is non-tender, and then no swelling of the lymph nodes in the axillary region as well. And you can put your arm back down. Next is cardiac. First, I would inspect for JVD, which Haley does not have any. And then I will palpate the chest. Perfect, and there's no heaves or thrills. I would find the point of maximum impulse, which is the fifth intercostal space at the midclavicular line. All right, and it's a regular rate and rhythm. Now, I will auscultate. For cardiac, I would listen with the bell and the diaphragm, but for the purposes of this video, I am just going to use one. So first, the apical. The aortic, I'm sorry. Pulmonic, Ersk's point, tricuspid, and mitral. All right, so it is a regular rate and rhythm. No murmurs were heard. S1 and S2 were normal. And then I would also listen to the carotids, one at a time. So no bruits, they were equal bilaterally, and then I would listen to the temporal arteries. All right, and so I would test both in real life, but there were no abnormalities, no bruits, and they were equal bilaterally. And then next we'll move on to the abdomen, and I'm just going to pull your shirt just a little bit. So first we would just inspect. The umbilicus is midline. There's no redness. I don't notice any scars, no lesions, no rashes. There appears to be no signs of a hernia, and her abdomen is flat. So first, I will auscultate before I palpate. All right, so bowel sounds are present in all four quadrants. Then I will percuss. Anything hurt? Okay. So it is tympanic. It's a little dull over the liver. And then to see the span of the liver, I would start to percuss here till I heard dullness, and then come up this way. And it's about 6 to 12 centimeters. And then the spleen I would do over here on this side as well. Then we would palpate the abdomen. We start light first. So any pain? No. Okay, no pain. And then we would do a deep palpation. All right, so I do not feel any masses. Any pain? No. Still no pain. All right, so the liver, spleen, and the kidneys are non-palpable. I would measure the aorta. And then for the abdominal reflexes, I'm just going to kind of tickle your stomach. Perfect, and her reflexes are present. All right, next we move on to the extremities. I would feel for her inguinal nodes. For the sake of this video, I won't do that in her femoral pulse, but it would be 2+. And then the inguinal nodes are non-tender, and they're discrete, and they're also mobile. And then I will inspect and palpate all extremities. For the purpose of this video, we will just do one side. Anything hurt? All right. So there's no obvious signs of deformity, no edema. Her skin is warm and dry. And then I will check all of her distal pulses, starting with the radial, the popliteal, the posterior tibial, and the dorsal pedis. All are 2+ and normal. Then I will check the range of motion and strengthen all of her joints. I will inspect and palpate each. So with your neck, we tested earlier, but you can move your neck side to side, chin to chest. Perfect. And then, let's see, push against my hand, against my hand. So she has 5 or 5 strength in the neck. Then we will move on to the shoulders. Can you put and we'll get you to stand up for this. All right. Can you put your arms up behind your back? Bring them forward. Perfect. And then can you push my hands, this way, okay? All right, now push up, push down. All right, so she has 5 of 5 strength. And then for her elbows, I need you to bend and extend and rotate. Perfect. And then let's see, hold your arms up, push. All right, and I'm gonna pull you Don't let me pull. Perfect. So she has 5 of 5 strength in her elbows. And then for your hands and your wrists, and you spread your hands, and then twist your wrists like this, make a fist. Perfect. Squeeze my hands. Awesome. So she has 5 of 5 strength in her hands as well. And then for your spine, I need you to turn around and I need you to bend. All right, so there's no obvious curvature of the spine for scoliosis. All right, now extend the other way for me. Perfect. Awesome. So and I'm also going to feel for your spinous processes. Any tenderness?
No.
No tenderness all the way down? No. All right, so there's no tenderness, no obvious deformities here. So for your feet and your ankles, I'll get you to sit back up on the bed. All right, can you point your toes in, flex them out? Perfect. And then I want you to pull against my hand and then push. Awesome. So she has 5 of 5 strength in her feet and her ankles. And then now I need you to take one leg, bend it in for me. Perfect. And extend it. Same with that. And extend. All right, bend your legs. Both of them. And then push against. Good. So 5 of 5 strength in her knees. So for your hip and your pelvis, I'm going to take your leg, flex it out. All right, back in. Now raise your leg. Awesome, perfect. And we'll do it with this side as well. Bend your knee, flex it out. Now straighten it back, and then lift. Perfect. All right, and you can relax your leg now. So that's a 5 out of 5 great strength as well. Now we will do the deep tendon reflexes. So I will have my hammer for this. For the purpose of this video, we will just discuss them. But first, we would start with the triceps reflex, and then we will do the biceps, and then the brachioradial, and then we would go down to the knee, the ankle, and then the plantar, the Babinski sign, which we would expect to be negative in an adult. All right, and lastly, the nervous system, her level of consciousness, we already established that. Just to review, she is alert and she is oriented to a person, place, time, and situation. There is no obvious cognitive impairment. She follows exams. Haley, can you tell me what you had for lunch today?
Sandwich.
All right, perfect. And then where did you go on your last vacation?
The beach.
The beach, perfect. So her recent and remote memory are both intact. She's able to recall that information. Okay, Haley, so I'm going to put an object in your hand. Close your eyes for me. And I want you to tell me what this is, okay?
A pin.
Perfect. Okay, so her stereogenesis test, which was a pen, is intact. Okay, what I'm going to do now, I have a sharp object and then a dull object. Okay, so I want you to close your eyes and I want you to tell me if you feel soft or hard.
Hard. Soft. Hard. Soft. Hard. Hard.
Perfect. All right, so open your eyes. What I want you to do, I want you to look right here, and I want you to touch, and then touch your nose. Perfect. So that is the cerebellum function. There's no deficits there. Her sensation was equal bilaterally with the sharp and dull objects. So now what I want you to do, I want you to stand, and I want you to walk heel to toe towards knee. Perfect. Okay. So you can take a step back, and then close your eyes and hold real still for me. Perfect. Okay, you can open your eyes. So with the heel to toe walk, she had a steady gait. She was well balanced, and also with the Romberg test, which was her holding still, there was no sway, so it was negative. Now what I want you to do, I want you to hop. Perfect. And then that is it. Thank you.